So Merce and Saskia, they are the co-founders of Reinserta. Dina is also a PhD student here, and she's doing research in schools. Merce and Saskia and their organizations are doing play, well, not play, but they're working a lot of things in prison, so they're going to share with us the bits about play. And me, I'm also a PhD student here with Dina, and I'm doing play in hospitals. So we did this talk for the Play in Hospital Awareness Week in Mexico last year, but it was everything in Spanish. So a lot of people from the university told me that they were very interested and if we could sort of do it or translate it, so we decided to do it again, but now in English. So we're gonna start with Dina, and just as a surprise, we have also Daniela. Daniela, she's an illustrator, and she is also Mexican. She is in the Zoom meeting also with Merce. She is an illustrator, and she's going to be doing graphic recording, but she's connecting from Madrid. So this is going to be a little bit of what we do in play for Mexican women. So
thank you, Paulina. Yeah, so I'm a third-year PhD candidate here at the faculty, and I've been trying to understand how learning through play is implemented or is understood by teachers in Mexican preschools, urban and rural. I'm going to share a little bit how they put it in practice, what they understand about it, and about the enablers and challenges. And here, what we liked about sharing within us is that we can kind of identify some enablers and some challenges that go across context in the three different institutions or settings where we can see play being put forward. So just a little bit about generally, and we've just listened about the importance of play. We know that through play, children may discover the world and also develop very important skills or their foundational skills. And learning through play, also called playful learning or play-based learning, is recognized as an important pedagogical approach in early childhood education. First, a little bit about Mexico. So in Mexico, since 2002, all children from 3 to 5 years old are obliged to attend 3 years of preschool. And in the last census, more than 63% of the children in this age range were registered in a preschool service, and the vast majority attended a public or state-funded preschool in either an urban preschool, which we call kind of regular, or a rural preschool, which is run by a specific agency who brings education to marginalized areas. So both urban and rural preschools follow the same learning goals. However, they have a slightly different pedagogical approach. So urban preschools have a child-centered model, and rural preschools have a community education model, which they have called a dialogue-based learning model. Both mention learning through play as important to facilitate learning in children, in preschool children. However, how they implement it and how it is understood in these two contexts is what it's not precisely defined. So therefore, my research investigates how Mexican educators understand and incorporate learning through play in the preschool practice, and what are the factors from these two contexts and overarching to shape how learning through play takes place in this context. So to answer to these research questions, I conducted 2 qualitative case studies in the north part of Mexico. One in urban preschools and one in rural preschools, and with 16 and 12 educators. And this was a qualitative. It was the fieldwork was conducted during the second half of last academic year, which in Mexico was still part or the last phase of the pandemic. So that also had an influence on my results. I collected data through qualitative case study methods with interviews, self-selected examples of pictures, lesson plans from the teachers, as well as observations. And to analyze, I started with an independent case analysis and then a cross-case analysis, also doing a lot of member checking and with teachers. So a little bit about the findings. I'm presenting their understandings, how it looks in practice very briefly, and then the challenges and enablers, which is our matter today. So starting with teachers' understandings, many educators make a very important distinction between what play and learning through play is. For example, in this quote, the teacher explains, well, play can be understood in two ways. Play as just playing, like free play, but learning through play more as a strategy that we use in the classroom, and often with an educational purpose defined by the teacher. But in general, many educators agree that learning through play is useful for young children, so preschool children, which is where I was conducting my research. So they agree. And what do we see then in the classroom? So we see play with objects, we see a lot of games, also traditional games, songs and singing games, we see physical play, and we see role play. And according to Mexican educators, they use play to practice and explore the content, to make learning fun and attractive, to stimulate social, emotional, and physical skills, to assess what children know and feel, to adapt teaching to the learners or the children's age, to create a positive classroom environment, and to relax or energize either before or after class or throughout the day. But nonetheless, teachers still face factors or things that may support or hinder their use of learning through play. They agree it's great. However, when they want to implement it, we still see some kind of tensions there. So I wanted to map all the factors, or the main factors that facilitated or challenged this. And I'm starting with the challenges, and they come, or what I found is that they come from 5 different domains. So we have the national curriculum and guidelines, and I'm going to go through them specifically, but network factors, preschool and classroom factors, children characteristics, and the educator. So starting with the national curriculum and guidelines. So a key challenge here is that when the guidelines teachers receive not necessarily prioritize or promote play. For example, during COVID, children were going to school less hours or less days. So they were asked to prioritize short and basic literacy and numeracy activities to help children to catch up. This measure encouraged teachers to play less because they didn't have time to play. They had to go to catch up on numeracy and literacy. So this kind of guidelines that contradict or ask the teacher to prioritize other type of activities. Then we have the network factors, which means the opinion, support, and involvement first of caregivers, teacher colleagues, and also in rural preschools, they talk a lot about the general community. For example, an important challenge is when a caregiver expects the children to work hard in school and not only play. This affects what the teacher decides to do or how much time they give to play. Then we have the preschool and classroom factors. This is very similar to other contexts. Maybe you've heard about this. So the preschool class size, the material, the equipment they have, the physical space. So it's not the same to plan activities in this preschool playground as in this preschool playground, right? So as you may expect, well, it's not the same, or it's not the same to for teachers to play with 5 children or 10 children from the same age or different ages, or a class of 30 children. Then about the children characteristics, teachers also mentioned that there are children characteristics such as their skills and knowledge that influence what they decide to do. For example, one of the biggest challenges they expressed, and this was in several classrooms, both in rural and urban settings, this is an example. So they are in the classroom, they were playing musical chairs, and everything was going great. But one girl was hungry, another one was hot, and then this one in the middle, she misunderstood a little bit the game, and she wanted to keep her chair in musical chairs. So she started crying when someone else took her chair, and the activity stopped, right? Because, and here is where the teacher explains to me that the activity stopped because all this was going on, and she's the only teacher. In this same classroom in the rural area, the teacher takes care of so many other things. She has to give toilet paper to the children. Some of them have to accompany children to the toilets. So all this obstructs what they are willing to do in the classroom or when being there. As teachers mentioned, to be sometimes afraid of this and therefore tailor the play activities to those where they feel comfortable, which can definitely change the form play takes place in the classroom and the extent of the time the teacher allocates to play. Last, and one I consider to be the most important, is the educator factors, and this was also acknowledged by the teachers. These include their skills, such as creativity, resourcefulness, adaptability, their communication skills with the children, their attitude and willingness to try and play, and their knowledge to teach through play or to keep a playful environment. So this highlights the importance of the teacher to decide and conduct learning through play activities. But also, they talked about, they also talked about that they create the enablers and challenges. So sometimes they acknowledge themselves. They were like, sometimes we create the enablers and challenges ourselves. So the very important role of the teacher. And then talking about, you might be thinking, well, the challenges, there's many challenges for this. What do we do? I think on one side, with these findings, we can influence policy, of course. For instance, this map of factors can help us identify what are the main challenges, how we can deal with them or navigate them. Influence policy, but also find ways in which we can empower the educator to navigate the challenges or to benefit from the supporters from the national guidelines, from the children, from what they have and what they don't have in the preschool, and also to work with the caregivers. So in sum, children benefit from incorporating play with an educational purpose. However, there are factors that support learning through play but also hinder it. Some can be challenged and changed by influencing policy, but others can be navigated or harnessed by working with the teachers. Learning from what they already do, I learned a lot about what they already do, but also co-creating together with them to find how to navigate this. So thank you very much.
So once we leave the environment of the schools, again, we're going into the hospitals to see how different this context is and these similar opportunities of how hard it could be to introduce play into a place that does not belong, really. But we're going to start with sharing, I'm going to share with you one of the notes of my field work. I don't know what's happening. There, okay. So this is an observation from my field notes. Okay. And this is just to explain mainly how vulnerable and how hard it could be to be in hospital as a child. Throughout my talk, please, I want you to, if you start thinking about, oh, the doctor, oh, the nurse, oh, please bring it back from how is this looking from the perspective of the child. So one of the things that the hospitals are a very complex environment when we have scientific, emotional, and structural challenges. Hospitals are a monster, and it's really very, very, very hard, or maybe there's no spots or opportunities for us to bring play into the environment. So all the focus of my research and the work that I do, it's also always trying to see how will the hospital look if we introduce play into this environment. And now, if you think the environment from the children's perspective, children might find that the hospital is scary, it's harsh, and it's also very uncertain because they don't know what's going to happen or sometimes why they're there, but it's also very boring because sometimes they're just waiting for things to happen, and it's boring, and they've said it so many times, like it's boring. And then the parent or the caregiver who is there with the children are usually worried, are overwhelmed, are frustrated, are exhausted physically and emotionally, and they're constantly waiting to be able to go home. They're like in this constant wait, it's like, is it now, is it now, is it now? It's always waiting. And also we have the healthcare professionals who have to work long hours, and according to the vision and mission of the University Hospital, they have to do all that longer, safe, kind, and excellent. So it's a lot. that they have to deal with. And all of that has to happen in an environment that is very complex, extremely hierarchical, and also very rigorous, because there's also the infections and this and that. So it's a very, very complex environment. So in the late 70s, an ethnographer, a medical anthropologist from the United States, she jumped into a hospital, and she spent a couple of months following the children, trying to see what they were saying. But the focus of her research was about death and dying. So she wanted to know how children were like little by little learning about their illness, the seriousness of their illness, and also discovering their own mortality. And in this research that she did in the 70s, she described a social order where the children are a work in progress, someone that are going to grow up and become adults, also the adults that are the caregivers who are there to protect them, and the healthcare workers that are there to cure. But when a child gets the diagnosis of like a terrible prognosis, what happens is that this social order breaks, because nobody is able to do what they're supposed to be doing. And when I was reading this ethnography, one of the many things that got my attention was how in this chaos, play and imagination was there constantly, and how children were trying to understand, to cope, and to be like make sense of the situation. And one of the other things that you might remember this, but the pandemic happened, and other medical anthropologists are starting to look into how, for example, bingo across the street and playing with megaphones was something important, and how play and games were useful in times of crisis, and how it's part of being human. So in this search or the challenge we have of how can we introduce play opportunities into the hospital, I know there's a lot happening, and there's a lot of people pushing very hard for this to happen, but I'm going to share a little bit of what I suggest and what I'm doing with my life and trying to bring play into the hospitals. So what I do mainly is to support scientific evidence and education. Because if we do not provide scientific evidence, this is not going to happen. Because we're talking to the healthcare system. So show me the evidence, or this is not, and they're just giggling, they see people giggling like, yeah. So you need scientific evidence. So one of the things that happened after many years in pediatrics, I was very, very frustrated with one thing in particular, that was keeping the children in the dark and not explaining what's happening to them, why, how, or why are you here, or just waking up from terrible surgeries, finding out what happened to your body. So while I was reading this, the ethnography that I just mentioned from the 70s, and reading more about play and imagination, one of my colleagues in UCL, she told me, have you heard of Health Play Specialist? I have no idea, never heard that. So if that's the case, just quickly, Health Play Specialists are not play therapists, it's a different profession, but the Health Play Specialists are also called child life specialists, child life therapists, and they have zillions of names. But the main, very, very superficial way to explain is they impart child-friendly information, they provide emotional support, and they normalize or create these opportunities for play. So I was obsessed that these people existed. So I went and asked them a lot of questions and asked them, how can I communicate with the children? How me as a doctor, as a healthcare professional, can bring what you know and use it into our practice? So one of the many things I learned from them is that, what about asking the children to write down their questions before the next hospital round or before the next appointment? And my study got validated by a 6-year-old girl when I was sharing my research with, in a summer camp of children with diabetes. A little 6-year-old said, I think that's very good advice. I was like, yeah, that's what I do. And she told me, it's because when I go to hospital, my legs start shaking and I forget my words. So now I'm going to write down my questions and the doctors will have to answer. And I was like, yeah, research validated. But the other thing that I learned in these conversations with the play specialists were the challenges that they face every day in their work. Because hierarchies, because this, because that, but mainly because people are not aware of the value that the play specialists bring into the healthcare system, but also because we sort of ignore the power of play in this setting. So Paulina got all wired up and she went into education and activism, and the cheapest way to do it was social media. So I started doing a little bit of social media, and I started doing a little bit of public speaking, and because I have the title of a pediatrician, I'm using it. Because I know that has something, so I'm using it, and I'm trying to target mainly physicians and specialists, so I can start hitting at the top of the food chain so I can start like making a little bit of change, hopefully. So this social media public speaking guide me to pediatric potential. It's a non-profit organization from the US where I've been working for around 2.5 years now. And we're trying to map, this is a map that it's in progress. So if you have any information, please let us know. And we're trying to find where in the world we have these professionals. Where does this figure exist? And how can we help them to bring child-friendly practices, psychosocial care, but also always being very respectful with the cultural aspects of each place where we work. And one of the projects that is very, very close to my heart is that in one of the many meetings about Play in Hospital, I realized that I was the only one from Latin America, and I realized that I was the only one speaking in Spanish. So I thought, let's do something. So that's the Play in Hospital Awareness Week that I target as or market as the Play and Health Revolution because it's for Latin America, has to have the word revolution. And we call it Semana Gym or Gym Week. And this is an online event that it's targeted for child healthcare professionals. And it's everything in Spanish because that's the goal. Because many things happen in English, so we do everything in Spanish. And that's where this talk of Dina Reinserta and me happened a year ago. Next one is in November. So now you're going to be, okay, so what's she doing here? This need for scientific evidence, I started seeing what the Lego Foundation was doing, but also speaking to the people in Denmark, I learned about the people here. And I learned about the project that Kelsey was doing and the projects that Lina was doing in Denmark. And I talked to both of them and I said, okay, what are you doing in Denmark? What are you doing in Cambridge? What is needed in the middle that I can do? So there comes medical anthropology. So remember the ethnographist that I told you? Well, the same idea of getting into the hospital, trying to understand the experience of the children about their illness and like the illness and the hospital experience, but instead of focusing on death and dying, is let's just focus about play and about these interactions between the children and the play specialist. So I'm starting the 3rd year, so this is what's happening at the moment. I'm doing my field work, I'm collecting data, writing like there's no tomorrow. I know that's gonna come and bite me at the end. But I'm right here between capturing data and about to lose my mind. So that's where we are. But I'm very happy to give you the never seen before. These are the first sort of things that I'm trying to put together. Before I can start collecting and analyzing what children think of these interactions between the play team and them, I'm trying to understand what does these interactions mean. So in a very academic way, I'm trying to classify them. And one of the things that I've been observing is that there's two main ways that these interactions happen. One is directly when they are in person in the same time and space. And then it's when the play specialist leaves the room and that interaction continues. Beyond space, beyond time, and sometimes beyond the play specialist, beyond the person. So just to give you one example of each, I'm also trying to organize this, so please bear that in mind. The direct interactions is, for example, when they prep them for surgery, when they are there playing with the face mask, not with the mask, the anesthesia mask and the anesthesia bag and the teddy and the cannula, and when they're one by one explaining all these things. Or when they are in the room while they're getting blood tests, or when they get a cannula, or whatever is happening. Or memory making, depending on the prognosis of the patient, which is footprints and handprints and stuff like that. But the thing that I was not expecting was these indirect interactions, is that, oh yeah, the play specialist is in charge of getting the playroom clean and ready. But I see them every morning cleaning for hours, and then in the playmat, they put Batman because the kid in this bed likes Batman. And then we have these many toddlers. Glitter is important. There's a lot of kids that like glitter, and they place the playroom. And then they go to see in every bed what the patient is doing, what the different patients want for those that can't go to the playroom, and I wait in the playroom. And I see how exactly the kid that likes Batman runs to Batman. The one that likes glitter goes to glitter because they have all this in mind. And I cannot describe the interactions between children and the play specialist if I don't take that as an interaction, because it goes beyond time and space, and it just goes expanding. And in individuals, I see how the parents learn how to play with their children when they have something like this not working, broken, and they learn, and also how the staff's like modeling and adopting these behaviors when the play specialist is gone. So this, I'm trying to word it as a ripple effect and how this is expanding. So I'm working in this. Don't expect it soon, but I'm working on that and trying to present this as a playful ripple effect. And about the perspective of children, it's very new, but I'm trying to guess, or not trying to guess, I'm trying to understand how children start figuring out who's my friend and who's my foe. But I don't want you to think that the foe is going to be the healthcare professional. The enemy, apparently, what I see is not the doctor, is not the nurse. The enemy is pain. So I'm just gonna keep working on that, and maybe next year I'll tell you. So the takeaway, I always ask, like, please acquire a pro-play mindset, but you're here, so you already have it. So I'm going to invite you to go into the hospital whenever you have to, and just keep an eye for those ripples. And if you find any of these ripples, please let me know, because I'll be more than happy to learn a little bit more of how it looks like outside, and then I will be very happy to pass it along. And thank you. A little bit more of how it looks like outside, and then I will be very happy to pass it along. And thank you. No, because I went a little bit over time. We're gonna see what's happening. Yeah, there. Ooh, nice. Okay. So thank you, Dani. We're going to move now to Merce, and Merce is going to be presenting from Mexico. So
thank you. Just a little note. There we go. We can see the slides. Thank you. Hi everyone. Nice to meet you. I'm Mercedes Castañeda. I'm from Mexico, and I'm a co-founder and general director of Reinserta, which is an NGO that has been working the last 10 years with children and adolescents exposed to violence in Mexico. I'm gonna tell you a little bit about myself. I am a clinical psychologist. I specialized in trauma, and before Reinserta, I worked in the federal government in Mexico, working with youth and violence also. So we're gonna start the presentation, and I hope we have time, and I'm happy to share all of the answers and all of the work that we're doing in Reinserta. Mina, could you start the presentation, please? I'm going to give you a little bit of context of children exposed to violence in Mexico. We have more than 2,060,000 children that have mothers and fathers who are incarcerated. Before 2016, these children were invisible. We started working in the prisons. We started going to all of the prisons in Mexico, and we started seeing a lot of children. And we thought that they were children that were visiting, or we didn't even think of that much. But then we got to know that these children lived there and were born there. And we started looking at the numbers, and we were so impressed by this situation, because there was any law, any rules protecting them. They were invisible to the law, invisible to the population. So we started focusing in who are these children and what do they need. The prisons in Mexico are not safe spaces. We have a country that it's taken care by the organized crime, and this is a relationship that we see in the prisons. So there are no exclusive spaces for children, for mothers in prison. So this is a topic that we decided to invest our time to gather money and to work with and to make it visible. So we have seen that this sad but with hope population has been seen thanks to Reinserta. And in 2016, we worked to change the law. We worked with the Senate, and we wrote a law that said that every mother who goes inside of a prison, who's pregnant or is pregnant inside a prison, should have her rights and her children's rights for family, play, development, health, education, food. So could we go to the next one, Mina, please? So to the next one, please. Thank you. So we created as a model. This model provides security, protection, mental health, and accompaniment to children who are born in prison, and also children and juveniles with an imprisoned parent. Why do we do this? Because in Mexico, we have, you go to a prison on a Sunday, on a Saturday, and we have lots of children running around. Some of them live with their mothers there, but some of them go every weekend to see a father, to see a mother. And this is a population that has been totally abandoned by the government, by the social organizations, and by Mexico. So what we do is we work with the mothers during pregnancy. We also work with a planned motherhood, because when we started, we saw mothers who had 80 years of sentence and they were getting pregnant, and we were like, what's going to happen to your children? But also the security of these women in prison, because the abandonment of the prison system makes it that we have rapes in prisons, we have men and women prisons who are mixed all together. So with putting a focus in this, we try to have the planning during pregnancy, the care during pregnancy, and while they are mothers in prison, positive parenting, motherhood skills, parenthood skills. We work with early stimulation and play. We give these children positive experiences. And when they are ready to leave the prison, when they are 3 years old, they cannot live in the prison anymore. So we do a healthy separation. It's a separation that gives them predictability and that gives them a securement outside. Who are they going to live with? What are they going to do outside? Who's going to take care of them? And this is all of the work we do. And then we work with them while they are outside prison, with their caregivers, with the mother who's inside the prison, the father who's inside the prison. So we do this family bonding, but always taking care and prioritizing the children's needs. I'm going to put a very small video so you can see what we're talking about, what I'm explaining. What we do, we transform lives that are marked by violence, especially children and adolescents who are in contact with the prison. This video shows what we do. We restore family bondages, we work with play, we work with mental health, and we give these tools for the families to prioritize the children and their development. We operate in 14 prisons. We have 1 care center for children and adolescents in contact with violence. We have dignified 5 of the most important prisons in the country, doing their own cells for children, and they don't have to leave the prison as gray and as dark as we would imagine. We drafted the maternity section of the criminal law, where they recognizes the existence and the rights of these children. And we have conducted and published 6 studies regarding the criminal justice system with public policy proposals. With this, we have impacted the lives of over 1,300 adolescents and juveniles who have maintained a non-recidivism rate. We have worked with over 1,400 children and juveniles with mothers and fathers who are deprived of their liberty, and over 40 children who are survivors of extreme violence. This is our bebetecas, our violence-free spaces. We have 5 bebetecas. These are spaces, as you can see in the right. These are the spaces that are inside of the prisons, where most of the time the children are there, learning, playing, working with their mothers, teaching their mothers how to play and how to have a responsible motherhood, and ending this cycle of crime. Because sometimes they tell us, like, that's the only way I know how to be a mother. That's how I was taught. That's how I was raised. So they are starting to see other forms of motherhood, and this is transforming their lives and their children's life. And also in the left side, we have a picture of spaces we create for places for male prisons, where they get visits from their children, and these are not safe places for them. So this is an example of a space that we created for children who visit their parents. It's a place where only children go. They have this space where they can bond with their fathers. They can have activities. They can develop play. They can we have abstract play, and they can have this imagination with their parents, and we give them the tools for have a responsible parenthood. This is the difference. No cells for children. No being in jail bars. No being everything gray, everything dark. So we give them the tools of being with their mothers, being with their families, but creating the attachment and the necessary relationships for them to have a healthy development. Another short video. This is a prison in Ecatepec, Estado de Mexico. You can see the cells. They are more dignified, and this is our team creating these spaces for children and developing, because it's not only the spaces, it's everything that we do inside of these places. We give not only early stimulation to the babies, but we give we have a program that it's called Raise and Play, and with this program, children play and their mothers learn to play with them, and they get to have these rights. I'm going to tell you a little bit the story of Diego. Diego is a kid who I met when he was 5 years old. This was before we changed the law, because before we wrote the law, every prison did whatever they want. We had prisons that said, okay, the mother just gave birth, we're going to take the baby away because we don't have spaces for children. We had other prisons that said, well, this kid is 14 years old. His mother wants him to stay. He's a minor. You can be there. And we had 14-year-old, 15-year-old who had never left the prison. So we made this rule for them to be regulated. So before the law, we met Diego. He was 5 years old. And I told him, like, show me where you live. And he gave me a tour of the prison. And he was like, you see that? That's a drug that you put in your nose, and that gives you a lot of benefit. Like, you're gonna be very happy. And he had this language, and he was exposed to violence. Her mother was a very complicated woman in prison. She sells drugs, and she used to put the drugs inside of the kid's diaper. So he was a kid who was exposed to all of this. And when he was 5 and he was going to leave the prison, we started working with him, and the transformation was incredible. We worked with sand play therapy with him. We worked with his mother. We worked with giving him predictability. We gave him tools. We even talked about language with him and the importance of communicating. He had this situation where his mother used to get in fights a lot. So what she would do is she would put Diego, like she would carry him, and she would fight with him in his arms, because she said that if Diego was there, the other woman wouldn't hit her harder. So Diego would have all of these emotional reactions, and he would tell us, like, I'm gonna be a lawyer because I'm gonna take my mother away from this place. So imagine the situation where he was growing up. So he was one of our first cases where we followed through and we worked with him, and he was playing in the Bebeteca, and he was learning what a dog was, because he only knew about dogs in books or when someone told about dogs. So we took the kids out to museums, to parks, even to trips to the beach. And we started, like, this is the world. This is not the only options that you have. And having a healthy relationship with his mother, teaching her mother, like what patterns is she repeating from her past. And he didn't have anyone outside where he could go. So we found him a very nice I don't know how he said in English, like a child, like a foster home, yeah. And we started taking him away for 6 months, 1 day a week, 2 days a week. He would stay overnight. He would pick his bed. Her mother made him a blanket for his bed. So we started doing this. And right now, Diego is 14 years old. He's studying. He visits his mother in prison. He still has this relationship, but he is someone that is thriving, and it's a very inspiring story. And he got through so many challenges, because he went to school when he was outside, and they were like, we don't want to play with you because your mother is a criminal. So this is what the children whose fathers in prison are exposed to. So a small situation. 1 second, sorry. No, please. Sorry, I have to revoice. So this is Diego, and this is what we do with them, and this is the importance of giving them these tools, and giving them the right of play, the right of health, the right of education. Next slide, please, Mine.
¿Me tienes? Simón. ¿Rojo o azul? A mí me gusta más el rojo. Dame el otro, mano. Que van a quedar divinas. ¿Cómo te puedes tomar esa sopa? Las chicas, venía a decirles que ahora con lo de mis cautivos voy a estar súper ocupada. Entonces, por si quieren almitas o algo, me avisan con tiempo, ¿va? Va, niñas, bye.
¿Qué tienes ahí, Estefi?
¿Ahí dónde?
¿Ahí?
No tengo nada.
Es un recurso mío, ¿verdad? A ver, dámelo. ¡Suéltalo! ¿Estás bien? ¿Estás bien?
meses. Papi, es tu cumpleaños.
Martínez. Y es hora.
¿Qué me pasa? ¿Te portas bien?
Can you hear me? We need to go to another room. Sorry.
Yes, thank you. No, it's over. And that was it. And well, thank you very much. And this is what we do. We work with lives who have been transformed by violence, and the importance of play in prisons. It's a key for having a safer place and to have a place where rights of children are respected. Thank you very much.